Welcome to today's webinar, The Road to Medicare and the 2026 Update, presented by Jeanie Schepisi. I am Daryl Davis Fulmer and excited to serve you as your host today. And I also want to thank Tracy Eubanks for her technical support today as well. Jeanie Schepisi joined the North Carolina Department of Insurance as a member of the Seniors Health Insurance Information Program, better known as SHIP staff. She did that in July 1996. So she's been with them quite a number of years now. She currently serves as the SHIP Field Operations Manager as well as the Central Regional Manager. As the Field Operations Manager, she oversees the SHIP Regional Manager team and is responsible for coordinating statewide partnership efforts. As the Central Regional Manager, Jeanie, you can get this straightened out after I finish if you'd like. Jeanie supports Alamance, Caswell, Chatham, Davidson, Forsyth, Guilford, Randolph, Rockingham, and Stokes counties. She also recruits and trains SHIP volunteer counselors and county coordinators. We're also joined today by our Executive Director Tim O'Connell, who will share some brief association updates. However, before he comes forth, here are a few things you should know. Each of you is muted to help help to ensure the presenters can be heard. This presentation will be and is being recorded. We will send you the link to the recording along with the handouts in our follow-up email. A survey will be in that email as well. For those of you who sent questions during the registration process, we submitted them to Jeanie, and she is going to or has incorporated many of those questions in her discussion today. If you think of a question during the presentation, please use the Q&A button at the bottom of the Zoom page. Questions will be answered during the Q&A period, if not before. So without further ado, here's Tim, RGEA's Executive Director.
All right. Thank you, Daryl. Appreciate the
You're welcome.
introduction. It's great to
Yes.
have you. And I'm going to say this, and we can go ahead and record this. Jeanie is one of my favorite people to work with. So that is safe for posterity. But she, between the wealth of information she has and just her attitude, every time she's in a meeting room, she brings joy and information. So I mean that sincerely. It's great to work with Jeanie, the Department of Insurance, and the Senior Health Insurance Information Program. I'm not quite to 65 yet. I'm getting there. But I know when I am coming upon that magic year, I'm definitely going to be talking to somebody at SHIP to get the best information. So I want to thank everyone for being members of RGEA. I cannot tell you what a difference it makes. We do not run on a political action committee or anything of that nature. We run on the good work and deeds you all did during your careers. And so when we go down to the legislature to speak, they know that I am speaking on behalf of the 350,000 plus public service retirees and the good work you all did. And they opened doors for that reason. And I'm thankful for you. And I'm thankful to be able to serve you as the entire staff of RGA and the board is as well. I'm going to share just a real few nuggets on what's going on right now, kind of on our daily work and mission type of work that is advocating for you. If you are a state employee right now, it's an important time because the legislature is coming in and out of sessions throughout this fall. They do not have a budget. It is a historical time, I would say, because of the distance in the budget between the House and the Senate. They have a couple more days that they're going to gather throughout the rest of the year. And we need you to encourage your lawmakers, the folks you elected, to go ahead and get that budget done and make sure that there is some money in there for the state retirees as they have the control over that. For my local government friends, I started my career in local government, good old Parks and Recreation. I want you to know that it's a different game for that, a different way of working. We are actually working closely with the treasurer and the trustees. They're in an important time right now. working on what's called the 5-year evaluation for the pension. There are variables within your pension that will be very influential in changing future outcomes. So this is big stuff that is going on right now. We don't have all the answers. We will not know until that study is released, that evaluation report. But I am optimistic on the future for elders with the work they're doing now. On the investment front, this is both for elders and teasers. To date, the treasurer is running ahead of projections on returns. It's a tough time to be doing that. So I think he's doing some pretty excellent work, and his investment team is as well. But I want you to know that there's some good indicators out there for the pension for elders and for teasers, but specifically for elders, because your benefit, your increases rely solely on how well the pension performs. So just sharing a little bit of information. We're going to have the Q&A open. If you want to ask me a question, just pop it in there. I will drop my email in there, but I'm going to be dropping in the background here and help support Jeannie on any questions coming through. But I want to thank you again for your membership. I want to thank Jeannie again, and I'm looking forward to this program because there is so much going on with Medicare, and I look forward to learning more.
Thank you so much, Tim, for that update. These are important matters. I'm sure everyone is concerned about these particular matters. So thank you so much. Jeannie, it is now your turn. So take it away.
Good afternoon, everyone, and happy Hump Day. And Tim and Daryl, thank you guys for your kind words. I reciprocate. I enjoy working with you guys as well, and have been working with RGEA actually before I joined the SHIIP staff in '96. I worked for Medicare prior to joining the SHIIP staff, and was an exhibitor at RGEA functions, and that's actually how I became a SHIIP staff member, is through RGEA and meeting the SHIIP director at that time. So you guys, I owe you more than you really know. So thank you guys, and thank you, Tracy, for your support and your assistance today. So I'm going to turn my video off so that it's less distracting to you guys. And I'm actually going to pull up a document. And while we are going to be talking about planning your drive towards 65, which is, as I age every year, Tim and I were talking, and we were talking about High Point, which is now university, and we remember it when it was college. And so I said, Tim, we're showing our age. So every year I get closer and closer to being my own client, kind of like the hair club for men president that said, I'm not just the president, I'm a client. So I'm inching up towards Medicare age myself, and it is certainly a hot topic. So the first thing that I want to do is to tell you a little bit about our program, SHIIP, with 2 I's and a P. In case you're not familiar with our program, or if you've heard about our program, maybe I'll share some information that you're unaware of. So SHIIP, SHIIP, stands for the Seniors Health Insurance Information Program. We were created back in September of 1986. So in fact, this very month, at the end of the month, we will be celebrating our 39th anniversary. And I have been with SHIIP for 29 of those 39 years. And I will just tell you in a nutshell that we help people make good decisions relative to their Medicare. We help people save money. And we do that in a neutral, objective, and unbiased fashion at no cost to the client, as we receive both state and federal funding. And so, Tim, when you were speaking about the legislature, the Senate and the House being apart, we are certainly feeling that, because our program is up for discussion, if you will, on a state and federal level. And we've had to share with people our information about the number of people that we've helped and the amount of dollars that we've helped people save. So we hope that our SHIIP is around for many, many years to come, because we do feel like that you can't get the level of service that's provided through our phone calls and through our face-to-face encounters that you could get with 1-800-Medicare. It's just not the same comparison at all. So we are a state agency through the Department of Insurance. As you can see, Mike Causey is our insurance commissioner, and I do bring you greetings from Commissioner Causey and all of your Department of Insurance staff. And our division was created in 1986 to help people with Medicare specifically. Whether you're on or going on Medicare, we're here to assist you. We do that in a few ways. We have a call center, and you'll see the 855 number listed, 855-408-1212. That number is available Monday through Friday, 8 a.m. to 5 p.m., except for state holidays and weekends. And you can access SHIIP or Medicare assistance through that number. But what is also good is that is a Department of Insurance number. So you, as an insurance consumer, whether you have an automobile or homeowners or life insurance question, that is the number that you can call. So I would love for you to save that 855 number in your phone as a Department of Insurance number to call. And in case you have any insurance related question, then you please reach out to us and we're here to assist you. If you call that number, listen to the menu. You're going to press the number to get to SHIIP or Medicare, and you're going to get one of our live call center human beings that are based at the SHIIP office in Raleigh. And again, we are here to assist you if you give us a call. We also have a wonderful website, which I'm going to show you something on there in just a few minutes, but it's pretty user-friendly, I think. And we were all talking about technology and how great it is, but it's not so great when it's not working. But I feel like our website is very user-friendly. But if you can't find what you're looking for, then please call us at that 855 number during normal business hours and say, hey, I'm looking for this. Can you help me locate that? And we're happy to do that for you. So this front page tells you what we do. We do not sell insurance. We do not receive a commission. In fact, one of the things that keep people from becoming SHIIP certified is that they cannot be or have an immediate family member who is a licensed insurance agent that sells the products that we assist people with, because that would be a conflict of interest. We also remind people that our services, again, are provided at no cost because of that state and federal funding that we're very, very appreciative of. And we also remind people that we collect information to assist them. And so any medical or financial information that we collect is kept confidential. And I actually assisted my husband's former boss as he was retiring and going on Medicare. And I said to him, you know, I know you know me and I know you personally, but I'm working as a professional and I'm here to remind you that anything that you share with me financially or medically is just between the two of us. So we pride ourselves on that. In addition to having our toll-free number and our website, we have an email address that's under How Do North Carolinians Contact SHIIP. So if you are like me, you do your best thinking in the shower at night when the SHIIP office is closed, but I don't want to forget something. So if you have a question or a comment or whatever, you can email us at this SHIIP email address that's listed here on the second line. And when we come back in the office, there is a designated person that goes to the email box and they reply. And the good thing is you get your reply in writing. So not only are you reaching out to us when it's not normal phone hours, but you're also getting your reply in writing, which is very helpful. And as of 1992, there is a program like ours in every state, and they are called SHIIPs with one I, State Health Insurance Assistance Programs. So we are a SHIIP, SHIP, whose name is SHIIP. So we have been doing what we were doing in North Carolina for 6 years, and the federal government had been watching us and was very impressed with what we were doing to assist Medicare beneficiaries or those going on Medicare at no cost without solicitation. So in 1992, they required every state in the country to have a program to help people with Medicare questions. And so we are called SHIIP, SHIIP. Virginia's called VICARE. Florida is called Shine appropriately, but my favorite is in the state of Ohio. They're called OSHIP with a P at the end. And so there is a program, if you know someone outside of North Carolina, there is a program that can assist them called an SHIP, State Health Insurance Assistance Program. I do want to show you here, and I probably have to stop sharing my screen and then share again. That's just kind of how it goes. But I will show you, if you go to our website, and I'm going to take you back to the home page. And I might have lost the sharing in that, so let me stop share and share again. Okay, so you guys should see a screen that says Medicare and Seniors Health Insurance Information Program. RGEA staff, if you do not see that, please let me know, but it looks like it's coming up on your end. So at the top of our SHIP website, which is www.ncship.com, there is a banner that pulls across the top. Currently, there are 5 different banners, but the very first one that has a lot of people that says SHIP counselors available in all 100 counties. If you click on the blue oval button that says find a local SHIP counselor, and you pull down, not very far, but just a little bit, there is a place for you to locate our coordinating sites in North Carolina. So while our call center is great in Raleigh, there are times that people really need to connect with someone locally in their communities. So what makes our program special and unique is that we contract with an agency in most of our 100 counties to serve as the liaison between the SHIP office in Raleigh and those in the communities that need assistance. So if you click on in North Carolina, there is a pull down county menu. And because I'm based in Guilford County in Greensboro this afternoon, you should see that in Guilford County, Senior Resources of Guilford on Benjamin Parkway is our resource, and it does give the phone number. Now, we have a person at that designated agency. They're called the SHIP coordinator, and it doesn't give their name. For example, this week, our coordinator in Guilford County, Christopher Mitchell McFadden, is out of the office. So in case you call this week and the coordinator is not there, it tells you to ask for SHIP help, and someone at that facility should be able to assist you. Normally, the coordinating site is a senior center. It could be a cooperative extension office, as it is in Surrey County, or a Shepherd Center, as it is in Forsyth County. It may be a council on aging, as it is in Union County, or even an area agency on aging, as it is down in the Robeson County area. So just call that entity and ask for SHIP help. And then underneath, where you can locate the SHIP coordinating site in the North Carolina counties, Alamance through Yancey, you can also look at a SHIP in another state. And you just click the buttons. The first one was blue, this one's orange, SHIP locator. And I'm going to pull up North Carolina so that you can see our information. It has our toll-free number and our website. And then if you want to look at another, so I'm going to pull up my favorite, Ohio, and you'll see there, OSHIP. So I wanted you guys to see how to find your local SHIP coordinating site in every county of North Carolina, as well as how to locate the SHIP in all other states. And the reason for that is, while we want to be your source, I tell people, if you don't know whom else to contact, contact us and we can help you. Try to answer your question. If we're not the appropriate source to answer your question, guys, then we will give you the information for the appropriate source. We're going to give you an appropriate referral and not the runaround. So wanted you to find out how to locate SHIP locally in North Carolina as well as in other states. For example, if you have a specific state health plan question regarding Aetna or Humana, and I did see some of those questions prior to our presentation today, then you need to reach out directly to those entities. We're not the horse's mouth at SHIIP for those programs. And while we do work closely with them and have information, we are not sometimes the entity to answer your specific question, and we want you to get the most appropriate information. And so if we answer a question, we might say, we can't go any farther at this point. You need to reach out to the state health plan, or you need to reach out to Humana or Aetna or the retirement system. So we will help you in any way we can, even if it's giving you an appropriate referral. So that's a little bit about the SHIIP program. Just like every state has a SHIIP, SHIP program as of 92, there's also a senior Medicare patrol program in every state that talks about Medicare fraud, abuse, and waste. And several of us are just a few years from Medicare eligibility, and we want Medicare to be around when we turn the magic age of 65. So there is a program specifically funded to talk about what is fraud, what is abuse, how can you identify it, how do you report it, and so the I guess motto of S&P is to protect, detect, and report. Protect your Medicare card, your Medicare number, detect by looking at your statements that come out on a monthly or quarterly basis, just like you would a debit or credit card. And then if you do suspect something, then report it. It could be a simple billing error that just needs to be corrected and refiled, and we can help you with that. But if we do suspect that it is in fact fraud or abuse, and it is out there, guys, someone asked me yesterday, so was fraud and abuse on behalf of the Medicare beneficiary or the provider? And I said, yes. So Medicare beneficiaries have been found committing fraud or abuse, as well as healthcare providers. And we don't want to think about that, but it is out there. And we want to protect that funding, and we want this program to be around for a long, long time. It's been around since 1966. So please help do your part in protecting, detecting, and reporting. And we even have people that can come out and do presentations on SHIIP and Medicare fraud and abuse if you're interested in that. So just reach out to us. At this time, I'm going to shift from the Medicare Basics document. We're going to come back to it, but I'm going to go back to planning your drive towards 65. So how are people eligible for Medicare, and what is Medicare? Medicare is a federally funded health insurance program that's been around since 1966. So it will be the magic age of 60 next year. That's a long, long time. And it helps people with their major catastrophic health expenses for inpatient and outpatient medical services. It is administered by the Centers for Medicare and Medicaid Services, or CMS, if you happen to see that logo, which is a branch of the Department of Health and Human Services. Who do you sign up for Medicare with? What agency? Well, that would be the Social Security Administration. So if you were enrolling in Medicare, either online or by phone call or by making an appointment to go to your local office, then that would be through the Social Security Administration. And then you've got your SHIPs that actually help educate and inform people about Medicare. So I tell people there's a lot of cooks in the Medicare kitchen, so to speak, but we all work together to make Medicare work and make Medicare happen for people. And we want that to be smooth and a successful transition. So again, that's why we're here. So we've created this document. It's a 4-page, short, sweet, and to the point document to help you plan that drive towards 65. So now that you know that Medicare is a federally funded health insurance program that's been around since 1966, who's eligible for Medicare? Well, if we were all in a room together, I would ask you, what's the most obvious way when you think of Medicare the person becomes eligible? Now, there's a little cheat up there on the screen. It says 65. So the most obvious way that a person can be eligible for Medicare is by turning age 65. And that's the Medicare that's been around since 1966. There's another group that's under the Medicare umbrella, and that became possible by Congress. Congress controls Medicare. And that was made possible in 1972. So 6 years later, in 1972, is when Medicare was created for persons under 65 on Medicare disability. So we did have some questions. If you're eligible for Medicare Social Security, how does that work? So how it works is if you apply for Social Security disability and you're granted that Social Security disability, and I will tell you, it might not be the first time. You may have to keep applying and reapplying for Social Security disability. And I tell people, if you keep butting your head against a wall, even a brick wall, at some point you're going to get through, and you might have a headache. But at some point, if you are truly disabled, according to Social Security guidelines, you're going to become eligible for Social Security disability. And you have to be receiving 24 months worth of Social Security disability before your Medicare kicks in. So we'll talk about that on the next page of how that happens. So those are the two ways that you can be eligible for Medicare: age 65, under age 65, receiving Social Security disability for 24 months. Okay. So this document, The Road to Medicare, is a 4-page, again, short, sweet, and to the point document that helps people make a smooth and easy transition. And so we want to let people know what we can help them with, what they may have to reach out to another agency to assist them with to help them get to where they need to be. And when I ask people how they feel about turning 65, people are confused, they may be frustrated, they're scared. There's lots of feelings and emotions as people get ready to turn 65 and become eligible for Medicare. But Medicare is a great program that provides a lot of assistance, and we don't want people worrying. We want to take the guesswork and the worry out of turning 65. The first at the top of this page, there's bullet points that tell you about the headings that are on the first page and the next few pages. Okay? All right. And so below that, it says caution, slippery road ahead. And under that bullet on the first page, it tells you several things that you should do before you turn 65. Um, One thing I would like to say about this, and we like for people to think ahead. We want people to know before they need us what they need to do. However, if you're calling a year in advance, then that's kind of way out there, because it may be that you're not going on Medicare until the next year and the figures change. So if you reach out to us, we're going to ask you, when do you turn 65? And so if you're turning 65 within 3 months, we say, oh, this is great. Let us get some information and help you. And if you are not turning 65 for about a year, then we will tell you, please diary this on your calendar, because we will be able to assist you better at that time. Okay. And then underneath that, on page 2, we talk about enrollment periods. And the enrollment periods, there's actually 4. These are for Medicare Parts A and B that we call Original Medicare. Okay. And so the first one is automatic enrollment. And we have talked about this a little bit already, but it's for people that are receiving a Social Security benefit for disability. And they have to receive how many months worth of Social Security disability checks before their Medicare kicks in? 24. So in the 25th month, then their Medicare will kick in about 3 months before that 25th month. So about their 22nd month of disability from Social Security. If their address is correct, and I encourage people to make sure their mailing address is correct, then they should be receiving a red, white, and blue card with their Medicare Part A and B effective dates, as well as their Medicare number. So people who are receiving Social Security disability benefits should not have to apply for Medicare. It should be automatic. If you are turning 65, the way that you're automatically enrolled in Medicare is that you are receiving a Social Security retirement check. And about 3 months before your 65th birth month is when you should receive that A and B red, white, and blue card. Again, as long as Social Security has your correct mailing address. Okay. Now, we talk to people about automatic enrollment and that most people may be automatically enrolled. And we used to say that. However, we have people that are turning 65 becoming eligible for Medicare, but they may not be receiving a Social Security retirement check because they want to wait until they draw their full retirement. It used to be that the full retirement age was 65, and that lines up with your Medicare eligibility. However, now that the full retirement age is 66 or 67, we have people that are waiting to draw full retirement at 66 or 67, but their Medicare will kick in at 65, and they say, well, I want to draw my Medicare or have my Medicare coverage, but I don't want to draw my retirement benefits until I receive full retirement benefits. So there are people that are not automatically enrolled that they have to enroll physically during the initial enrollment period. And that initial enrollment period is a 7-month window that straddles their 65th birth month. And then it includes the 3 months before, the month of, and 3 months after. Now, the exception to that rule is if you have a birthday that's the first day of the month. So if your birthday is the first day of the month, only the first day, then your Medicare begins the month before. So if you have a September 1st birthday, your Medicare would start August the 1st, and that 3 months would be pushed back. And so that's what we look at. And we give you a little chart about the initial enrollment period and how that 7 months pertains to you depending on when your 65th birth month is. Okay. Now, there's another enrollment period at the bottom of that page called general enrollment. And general enrollment rolls around every year like clockwork the first 3 months of the year, January 1st to March the 31st. And that's great. But most people do not need that. Most people are either automatically enrolled or they enroll during their initial enrollment period. But if you do need general enrollment, it's January 1 to March 31st. And the coverage begins, and this changed a few years ago, but the coverage begins on the first day of the month following the month that you enrolled. So if I enrolled during general enrollment because I wasn't automatically enrolled and for whatever reason I missed initial enrollment, I enroll in January, then my coverage starts, and that is February the 1st. Okay. Social Security will tell us that most people do not have to go through general enrollment because they're either automatically enrolled or initially enrolled, and they do that themselves. And I see, Tracy, you have your hand up.
I do, Jeannie. I'm sorry to interrupt. We've had a couple comments just asking if maybe you could zoom in a little bit on the PDF.
Oh, of
I'm
course,
not
yes.
sure. Yeah.
How's that? I'm sorry, guys.
You're fine. We'll see. Oh, that should be good. Y'all let us know if that's better. And apologies about that. That's great, Jeannie.
Okay, thank you,
Okay,
Tracy.
no, thank you.
So we know about automatic, initial, and general enrollment, but there's also one that's very popular. And if you are in your initial enrollment period, the month that straddles your 65th birth month, 3 months before, 3 months after, then you are not able to partake in what we call special enrollment. And special enrollment affects a lot of people as well. So, special enrollment is for a person that is becoming eligible for Medicare, and because they or their spouse are actively working, and that's the key right there, they're actively working, they do not have to and may not need to take out Medicare while that person's actively working with employer group health insurance that's primary to Medicare. So we have people that are turning 65, they call us, we ask them, when are you turning 65? If they're in that 3 month window, we then ask them, are you actively working or are you married and your spouse is actively working with group insurance at work? And then we go to this special enrollment period area. So this is one that's very, very popular. However, if you work past your 65th birth month, but you're still in that 7-month initial enrollment period, then special enrollment does not apply to you. Initial enrollment overrides special enrollment. Okay? All right. So now that we know who's eligible for Medicare and what is Medicare, let's talk about which way to supplemental coverage. So the good thing about Medicare A and B is that you can take that anywhere. But the downside is that there are gaps. There's deductibles and copays and coinsurances. So you either need a supplement to fill in the medical gaps where A and B leave off, or you need to get a Medicare Advantage plan. So this area, which way to supplemental coverage, talks about Medicare supplements that only work with Medicare A and B. That's their only function. They do not work with employer group plans. They do not work with Medicare prescription drug plans or Part D, and they do not work with Medicare Advantage or Part C plans. The only function of a Medicare supplement is to fill in where Medicare A and B leave off. And I'm going to show you what those plans look like on that other document, the Medicare Basics, in just a few minutes. If you have A and B Medicare, again, that's your medical, inpatient, and outpatient coverage. You would need a supplement to fill in those medical gaps. And then you would need a Medicare Part D drug plan that's a separate standalone plan because neither A, B, or the supplement cover outpatient prescription medications. And what are those? That's if you go to your pharmacist to get your prescription filled, or if you're at a facility like a hospital and you're not admitted, you're outpatient or day surgery or observation, and you get a prescription, then that would be outpatient under Part D. And we encourage everyone to have some type of drug coverage. And if you don't have an employer plan or you're not eligible for military coverage, then you do need a Medicare prescription drug plan just in case. Think of how we write our check for our automobile insurance every month, hoping that we don't need it. But if and when we do need it, it's there, and prescription drug coverage is the same. We've tried to encourage people to have a drug coverage of some sort. And we've seen people say, well, I don't take any medicines, or I take very few, or I take generics. And in that case, they don't take it out. And then later their provider writes them not just a medication, but an expensive specialty medication, and they have no drug coverage. They have to pay for it out of their pocket. Then when the Medicare open enrollment period rolls around, those people can get a drug plan, but there's a penalty for most people at that point. So we try to be proactive. Insurance of any kind only works if you have it, hoping that you don't need it. That's what insurance is. It's a roll of the dice, or a gamble. Okay. So employer or military retiree coverage is if you have TRICARE for life, you're retired military, or you are eligible for VA or veterans benefits. And then we talked to you about that. Again, we're not the horse's mouth, but we can tell you how those plans work if you have Medicare, and do you need Medicare in addition? And most of the time, yes, you do. And then Medicaid or Medicare savings programs are for people with limited income, assets, and resources. And this is where the Department of Social Services in every county comes into play, is they're the people that actually take applications and have the figures for qualifying. But if you meet with us at SHIIP and we screen you and we determine that we think you may be eligible, there are applications that we can do to help with that Medicaid or Medicare savings program process. Medicaid or Medicare savings programs help you with your medical expenses for inpatient and outpatient services. And then this is where we talk about Medicare Advantage or Part C. And this is the other side of the fence. If you decide for some reason maybe you can't afford a supplement, or you like that your medical and prescription drug coverage are all in one package, then we have Medicare Advantage plans that we can talk to you about. People like these because they're affordable. With a lot of these plans, there may not be a monthly premium. You do have to pay your Part B premium with an Advantage plan, just like you do when you have A and B. but you can maybe get a policy through an Advantage plan that has no monthly premium, or it might be less expensive than that of a supplement premium. And it's all inclusive. These plans have medical and most often prescription drug coverage. But what we do caution people about is these bells and whistles, I call them sprinkles on a cupcake, that these companies use to attract people to these plans. It may be dental, vision, and hearing coverage. It may be you get money back from for your Part B premium. It may be a fitness membership. It may be that you get a catalog to choose from or money for your groceries. And those things are all great, guys. I like a good deal and a bargain as well. But bottom line is, does the plan cover your prescription medications that you currently take? And are your healthcare providers in network? If it's an HMO, if it's a PPO, you can go out of network, but you're going to pay a higher copay. So we try to bring people back to reality and talk to them about their options and exactly what they need to consider, depending on what plan they're thinking of joining. And then at the bottom of this page, stop to get help. We talk about some resources. Of course, we have our SHIIP contact information, the number for Medicare, Social Security. If you have an employer plan, you need to speak to your HR or personnel representative. If you have limited income and resources, your local Department of Social Services. And if you're retired military, then that would be your TRICARE for life. So hopefully that document, The Road to Medicare, is helpful to those of you that are getting ready to turn 65 very shortly. Again, it's good for it to be on your radar in advance and know about us before you need us. However, about 3 months before you turn 65 really is a great time for you to start focusing on that thought process. And again, we know the screening questions to ask. Going back to the Medicare Basics document, we have already reviewed who SHIIP is and what we do and how to contact us, as well as Senior Medicare Patrol. But when someone meets with us, we show them this chart, and it's in the Medicare and You Handbook. You've got two options for your Medicare coverage. You've got your Medicare A and B, which is your red, white, and blue card with inpatient and outpatient coverage. And to fill in those gaps of deductibles and copays is a Medicare supplement that you have to pay a separate premium for. And I'll blow that up. Sorry, I was thinking it didn't auto blow up when I went to the next page or the other document. And then because you need a drug plan of some sort, you would need a separate standalone Part D plan. Again, we can help you with that. We can actually enroll you in the Part D plan and give you information about supplement plans and companies and prices. The other side of the fence is Medicare Advantage. Again, your medical and prescription drug coverage are combined into one big ball, if you will. It's like an all-inclusive cruise, but it does operate on a network of providers, whereas with A and B, you can see any healthcare provider anywhere, and as long as they accept Medicare, you're good to go. With Original Medicare and its components on the left, you tend to pay more upfront in premiums and lesser on the back end in copays. And it's the opposite with Medicare Advantage on the right. You tend to pay less upfront in premiums, but more on the back end in copays. Again, if you're in network, the copays are going to be less than if you go out of network. And we're going to rotate this document. We have the Part A chart for 2025. Congress decides what these figures will be. I will answer probably one of the big questions that you guys have. When will we know these figures? And there's buzz and there's talk until we get in writing from our reliable sources, either the Centers for Medicare and Medicaid Services or Social Security. We don't share this information, and it's usually about November. It varies. When I worked for Medicare, we got the figures, and they were able to even put them in the Medicare and You Handbook that's being mailed out in September. So keep your eyes open for that. But the past several years, we don't usually get the Medicare A and B figures until November. And as soon as we do, we revise this document. But Part A is the inpatient or hospital part of Medicare. The services that are covered are in the column on the left. The benefit is in the form of days, not a dollar figure, which is interesting. What Medicare pays, and then what you may pay out of your pocket. And this page does show you the Part A premium at the bottom, which most people do not pay. If you or your spouse worked at least 10 years, which is 40 credits or quarters, and you paid in to the FICA system, then your Medicare Part A would be premium free. And that's what happens for most people. But if you did not work enough or didn't work at all, or you're not married to someone who did, then you may have to pay that Part A premium. And it's based on the amount of quarters or credits that you worked and paid in. The Part A deductible is in the far right column, the top row. And what's interesting about that deductible, that's a lot of money, guys, and you may have to meet that more than once a year because of what we call a benefit period. So if you're in the hospital admitted as an inpatient and then you're out for 60 days or more and go back in, then your time starts ticking all over again. So we tell people that so that they're not surprised. And that's why a supplement is very, very important to help fill in that gap. And then on the next page, we talk about Medicare Part B, the second part of original red, white, and blue card Medicare. And this is where most services are covered, your doctor visits. You'll notice there is an overlap in home health between A and B. That's a shared benefit depending on what your situation is. If you're admitted to the hospital as an inpatient, that's covered under Part A. If you're not admitted to the hospital, your outpatient observation, emergency department, what we used to call emergency room when I was growing up, then that's under Medicare Part B, and the payment structure is different depending on if you're inpatient or outpatient. Again, the services are listed that are covered under Part B, the benefit, what Medicare pays, which is usually 80/20, and then your deductible and copays are listed. The deductible this year is $257. You meet that once a year, and then you're done with it. And then the Part B premium this year is $185 a month for most people. There may be higher premiums if you were penalized and you enrolled in Medicare Part B during the general enrollment period that we talked about earlier. If you were without Medicare for more than 12 months when you enrolled in general enrollment, or if your income amounts are higher because you're receiving income from working, or you sold home or land, or you won the lottery. And that is looked at individually when you're filing taxes, or if you're married filing joint taxes. And that is a Social Security program called IRMA, IRMAA, which stands for Income Related Monthly Adjustment Amount. If you do get to these IRMA figures, you will get a letter from Social Security telling you they're going to impose that IRMA. You may appeal it. There is a small handful of reasons. For example, they look at your income 2 years back. So if you're MSI this year in 2025 because you're actively working, but you go on Medicare 2 years from now and you're no longer actively working, so your income is not in this IRMA bracket, then you can appeal that. I won the lottery and I blew it is not a good IRMA appeal reason. So we do talk to people about that. We give them general information, and then we refer them to Social Security because that is the direct source, and they should have received a letter from Social Security with information and with Social Security's contact number on there. May have lower Part B premiums. It could be that you have limited income and resources and the state's paying it for you. Or you're protected by a law called Hold Harmless, which says that your Social Security check cannot go down in December of one year to January of the next if they raise the Part B premium and considering the cost of living. So that's a law called Hold Harmless that says you will not pay more Part B premium to keep your Social Security check the same from December of one year to January of the next. And that is a Social Security program as well. So your Part B premium is usually $185 this year. It will change in January, but it may be higher and it may be lower for a couple of reasons. The next page, these are the supplement plans A through N. This actually was created the year that SHIIPs were required to be in every state in 1992, and they started out as A through J. Now they've added some letters, K, L, M, and N. They've taken away some letters. So this is the chart that people look at now if they want to pick a supplement to go with Medicare A and B to fill in those medical gaps. And C and F are pulled out to the side because if you were eligible before January 2020, then you could purchase a C or F plan. I'll just throw in a little side note. I don't know why you would want to do that, but you can. And then after January 1, 2020, Medicare eligibility, you can only get A through N, that's in the main part. And it tells you on the left what the benefits are under each plan. And plans, prices, or premiums vary depending on the plan that you select, your age, your gender. Usually female rates are lower than male. It could be based on your zip code, and the company that sells it. But those rates, those supplement rates, are heavily regulated by our Department of Insurance. And there's about 40 some companies that sell Medicare supplements in our state. And we use this special database to help you search for Medicare supplement companies, plans, and prices. Medicare Part D is the prescription drug benefit that started in 2006, and we talk about that here. If you've got limited income and resources that we screen everyone for that we're helping, and we identify that you might meet those requirements, then we can do those applications for you right then and there, making it convenient and hassle-free for you, and those prove to be quite helpful. Part D, extra help assistance. And then we can also screen you for Medicaid or Medicare savings, which help you with your medical expenses. And that can be quite helpful for people as well. And then we talk about Medicare Advantage Part C. Again, these are your HMOs and your PPOs, your special needs plans. And we talk to people about those. We get lots of questions, but we want to make sure no matter what product you have, going in, you understand how that program operates. And if there's any restrictions or limitations, we want to make sure that people understand those as well. And then the last thing on this Medicare Basics is preventive benefit coverage. Whether you have A and B or an Advantage plan, these are the benefits that are covered as preventive routine screening. This is just a checklist. Please refer to your Medicare and You handbook. And there's a little blue apple that has these services listed, and it gives you more detailed information. Or take this list in your healthcare provider and talk to them about what you can get and how often it's covered and so on and so forth. Usually there's no deductible to meet and there's no copay for these preventive benefits. Now, after looking at those two documents, I do want to remind you that the Medicare open enrollment period for people that have Medicare products is October 15th through December 7th every year. And so if you have Medicare Advantage Part C or Medicare Prescription Drug Part D plan, then you will need to compare your plan in the fall during open enrollment, because the plans change every year and we want to ensure that you have the best coverage at the best cost. That's what our goal at SHIIP is. The state health plan, for those of you that have either the Humana, one of the two Humana plans, or the Aetna plan, the state health plan open enrollment for retirees and actives like myself is October 13th through October 31st. And I will tell you, someone last week when I was at a conference, they mentioned that they had gotten their decision guide about next year's offerings. I have not received mine yet, so I'm imagining they're going out. So be on the lookout for that. Guys, I tell people the state health plan does a really good job to educate and inform us. We need to do a good job on our end of opening that document and looking at it. So be aware of what's coming to your mailbox. This is a busy, exciting time of the year for information to go out to tell you about the changes, but we have to be good clients or good consumers to look at the information that's being sent to us. And I know there's some marketing things that maybe you really don't need to be concerned with, but if it's a company that you have your current plan with, or the state health plan, or Medicare or Social Security, then yes, you do need to pay close attention to those. We are so fortunate that when we retire from the state of North Carolina, depending on when we were hired, that we have the option of keeping our group health plan when we retire and even into our Medicare years. We see many people that as soon as they stop working, that health plan goes away, or it's with them until they turn 65 and then it goes away. We are so fortunate, guys. And not only are we fortunate for that, we're fortunate because the coverage is good, and it's affordable. However, there are other options out there for you, and we can help you look at those options if that's what you'd like to do. So you can reach out to SHIP for that. But if you need specific information and specific questions answered about the state health plan, the Aetna or Humana products, then you need to reach out directly to the state health plan, and their number is on the back of your membership card. I do want to remind you that the Medicare New Handbook is going out in September. That is kind of your owner's manual if you're on Medicare, but if you do take one of the state health plan options, your coverage, would be through the state health plan, and at that point, your decision guide from the state health plan is your key source. So that's everything that I have. Do we have questions that are in the Q&A?
Yes, Jeannie, thank you so much for all of this. I don't care how many times I hear this, I hear something new every time. So that can help me to even do better with what I have with Medicare. So one person asked, would you please back up and comment on COBRA benefits if you're over 65 and have Medicare Part A only?
Right. So when you have COBRA, that is group insurance that you're being offered because you're no longer actively employed. And that is a bridge. I tell people COBRA's not a snake, it's a bridge. And it gets you from the employer coverage that you're losing to another form of health insurance, and it could be Medicare. So you're offered that COBRA, it bridges you until you become eligible for Medicare. And at that point, then your maybe guarantee issue rights for a supplement will go away, or you have limited amounts of time. So COBRA is not to be considered as creditable coverage because that COBRA is bridging you to another source of health insurance, and Medicare is another source of health insurance. So if you're on COBRA, when you become eligible for Medicare, you need to reach out to us or someone to talk about that because we don't want you to miss things and be penalized. If you've already got Part A, then you're eligible for Medicare already. So even if the company's offering to pay that COBRA premium for you, which sounds great, and maybe there's good benefits, there's dangers in that. So please reach out to someone at SHIP and let us help you with that because COBRA is only a bridge to get you to another health insurance. And if that other health insurance is Medicare, then you might not want to continue that COBRA coverage, even if your employer's or former employer is paying it for you and it has great benefits. That can
Okay,
be very
great.
dangerous. So thank you for that question.
Yes, thank you. Now I have another question. If I'm eligible next year and my spouse is older but does not have enough working credits, can he sign up with me? Presently, he is working and has insurance, but would like to retire next year.
Okay, so your husband, is he 65 yet?
So let's see, if I'm eligible next year, the spouse is probably 65.
Okay, so you can draw under your spouse's Social Security benefits, which would lead you to your Medicare benefits. And I would encourage you to reach out to Social Security just to confirm that you've been married for 10 years and you paid in. They can tell you who you can draw your retirement under and who you're going to get the most out of, whether it's you or your spouse, and if you can draw Medicare under your spouse's work record. And
Yes.
I
Okay.
encourage people, guys, if you go to the socialsecurity.gov website, you can do a search. You can do an office locator and put in your zip code, and it will tell you who your local office is because there's not a Social Security office in every county or every city, unfortunately, but it will tell you who your local office is. I encourage people to call their local office instead of the toll-free number, and their toll-free number is on page 4 of that Road to Medicare document. It's 800-772-1213. That's the Social Security national number. They are open extended hours past the local offices, but if you're calling during local office hours, I encourage people to call their local office and try to get assistance that way, because I think it's a little bit more personal than if you call a national number. Not that they're bad or whatever. I just feel like that local office maybe feels a little bit more personal when you call.
Okay. And Jeannie, we've run out of time for other questions, but audience, we're going to capture these questions. And Jeannie, maybe we could send those over to you. And then if you can answer them, then we can get them out to everyone.
Yes, or again, guys, call the SHIP office in Raleigh at 855-408-1212. I hate for your answers to be held up. It's not that I don't want to help you, but in addition to managing our regional manager team with four other people, I have 9 counties that I support, and I'm out on the road quite a bit, and open enrollment's coming up. So if you have a specific question, you may want to reach out to your local coordinating site, and we saw how you can locate that. But if you have a general question, you may want to call the SHIP office in Raleigh, because if I'm out and about doing a training or a presentation tomorrow, in Burlington speaking to city employees, then I'm not available, and I just don't want your questions to wait for me when maybe someone else can help assist you quicker. It's not that I don't want to help you, but I am on the road, and these days driving, I focus on my driving because there's crazy people on the road. So I try not to talk while I'm driving, even hands free. But again, thank you guys for this opportunity. It is an exciting time of the year, and we just want you to have the best coverage at the best cost. And there's lots of resources out there for you. That's the bottom line. And people want to help you. So reach out and let those resources assist you.
Yes, thank you, Jeannie, for all of that. And we are grateful that you were able to do this today. We appreciate all the information you've given. And audience, please make those phone calls, contact the agencies that she has listed, and we will be sending out information that will also include a survey later this week. So if you could get us responses back by Friday. If you have other questions, you can always reach out to me, Daryl at NCRGE. I'm sorry, Daryl at RGEA.info. And my
Old
husband
habits
is
are hard to break, aren't they,
I
Daryl?
know, aren't they? Aren't they? So our next Lunch and Learn webinar will be held on Wednesday, October 15th at 12:30. Amy Korb with the American Red Cross will discuss Experience Matters, how retirees are changing lives with the Red Cross. We'd love for you to join that webinar. It's important. Many of you have asked about volunteer opportunities, and Amy will also share some information on CPR hands only as well. So thank you all again for joining today. And as always, the association stands ready to assist you in your retirement. Watch for that follow-up email with the recording, as well as the survey and the handouts. And we appreciate your attendance today. Happy Wednesday and stay safe.